All right, good evening, ladies and gentlemen, and welcome to the Redshores grandstand here tonight for a special presentation, Strangles 101. And we're just going to give you an update on where we're broadcasting from here tonight. I know some folks that are tuned in online tonight, or those that are here, but if you're getting text messages from other folks trying to find us, it is simply at our broadcast location at Redshores.ca. Click on the live broadcast and you will see the broadcast player, and you just click watch, and away we go. So if you have any folks that are, trying to find us and they're reaching out to you, that's where you will find us. And I know several of you tuning in here tonight, and we do appreciate that wherever your location may be. It's also on Channel 2 and your in-house monitor, and that means, of course, it's being broadcast to the barn and barn areas as well. So we want to welcome you. And we look forward to tonight's presentation, and without further ado, I'm going to turn it over to Dr. Kathleen MacMillan for tonight's presentation.
Hi, everyone. Can everyone hear me okay? I want to thank you for coming. It's been a very stressful time for a lot of people. I was asked to give this presentation mostly just to give you information. So Strangles is a very scary name. I think if it was called anything else, it wouldn't be quite so scary, but it is scary, and it has a potential to really affect us as an industry. So I'm a veterinarian at the Atlantic Veterinary College. I'm an equine ambulatory veterinarian, so most of my time is spent out on farms, treating your horses. Part of my role there as well is to educate students, so I teach students, and I also do public outreach. So this would be one of those opportunities where I'm able to come and hopefully help ease your fear. I care very deeply about my patients, about my clients, and I care very deeply about the industry. So hopefully after tonight you'll have more information, you'll be more comfortable with Strangles, and I understand everyone's scared. I'm scared too, but hopefully once you understand more about the disease, how it's transmitted, and kind of where we go from here. For those of you who don't know me, I'm a veterinarian. I also have a Master's of Science degree, and I'm an equine specialist as a diplomate of the American Board of Veterinary Practitioners. So tonight we're going to talk Strangles 101. Basically, is your horse at risk? And I think that that's kind of what everybody wants to know. I do have some good news. We do feel that currently the infection is localized. It does not appear to be widespread. There's been one clinically affected case. Some other horses have tested positive for exposure, but to the best of my knowledge, there are no other clinical cases of Strangles, and that was released by the Racing Commission earlier this week. So this is a slide that I always share with my students. We're all guilty of Googling, and I do it all the time. The problem is that not all the information out there is accurate. And for instance, if you Google Strangles, a lot of sites will tell you that it's a virus, but it's actually a bacterial infection. And the other issue that I find is that a lot of the information is actually outdated. So when I saw my first Strangles case in 2002, things were very different. We handled them very differently. The testing was very different. In the last 18 years, we have progressed quite a bit. And how we manage Strangles, how we diagnose Strangles is, I think, certainly a lot more advanced than it was back in 2002. So I'm not saying don't Google things. I just think that you need to go to reputable sites, find current information, and hopefully that will just help you make informed decisions at the end of the day. The talk that I'm presenting tonight, the information is based on the ACVIM consensus statement. So that is the American College of Veterinary Internal Medicine. These are a group of people who are way smarter than I am. And they are the leading experts in the world. And they are the ones who decided that this is the important information that we need to know for Strangles. So The information that I'm providing is from the consensus statement. It's 15 pages. It's pretty heavy reading, but there's a lot of great information. What's also important is that this was updated in 2018. So this is current information, and this is how we guide our decision-making process as veterinarians. So today we're going to talk about strangles, what it is, what are the clinical signs, how it's transmitted, some of the complications. Like it is a little scary, some of the things, but for the most part, the complications are pretty rare. So I'm just going to touch on that. But more importantly, the diagnosis and treatment, as well as control and prevention. Biosecurity is the most important thing when you're dealing with strangles. And I just want everyone to know that it could happen to any of us. It truly could happen to any of us. How many times have you brought a new horse into your barn without isolating it for 3 weeks? Or you've gone to another track to race in a stake race and you're racing out of someone else's barn. So every time your horse comes into contact with another horse, there are risks. And I just want to really emphasize that the more measures you take to prevent contracting the disease and spreading the disease, the safer your horse and everyone else's horses will be. So Strangles is a bacterial infection. The long name is Streptococcus equi subspecies equi. We call it S. equi or just Strangles. It's an infection of the upper respiratory tract, and it is highly infectious. And what happens is that the lymph nodes in the throat, and there's 2 pictures at the top that will illustrate that, the lymph nodes become very swollen. And they can become so swollen that they can actually effectively strangle the horse by cutting off the airway. And that is why it's called Strangles. It has a high morbidity and low mortality. So that means that a lot of horses can get sick from it, and it can spread through a barn very easily. But very few are actually going to die from it. So that is very important. It's kind of like, the common cold. A lot of people get sick, but the consequences are usually not so bad. I won't say that about COVID, but for the common cold. It's also reportable in many countries, for the United States, for instance, but it's not reportable in Canada. So that is something that is important to keep in mind because it is not something that is nationally reportable within our country. And it's endemic. So endemic means that it's here. It's within the horse population, and it's worldwide. So you're going to find it in every country around the world. And it's been around since 1215, so over 800 years. And if we could have gotten rid of it, we would have gotten rid of it. The truth is, it really hasn't affected us as an industry so much. You see it more within riding horse populations, and certainly in 2018, we had a regional outbreak throughout the Maritimes, and at that time, I gave a public presentation as well. And it is here, but I don't think that it has really hit us at our core, and that's kind of where we are right now. So what's most important is that you can identify when your horse is sick early on in the disease process, because that is going to help you prevent spreading it to other horses. The first clinical sign that we typically see would be a fever of 38.4 Celsius or 100 or over 101 Fahrenheit. Often, though, the fever will get above 40 Celsius and 104. So if you've ever had a high fever, you can appreciate just how shitty you're going to feel. The lymph nodes become very swollen, and these are the submandibular lymph nodes, so the lymph nodes that are under the horse's throat and chin, as well as what we call the retropharyngeal lymph nodes. They're lymph nodes at the back of the throat. And these become so sore that often the horse will just stand there with their head stretched out because they're so uncomfortable and they're just trying to find any alleviation of their pain at all. Usually they'll have snotty noses, so it's going to be purulent or kind of pus-like, and they're going to feel kind of depressed and kind of punky, as one of my clients used to say, because they're just not feeling well. They have a fever, their lymph nodes are swollen, you know, they often feel like they got run over by a big truck. So other clinical signs that we'll see are sore throats, which we call pharyngitis. So when the lymph nodes are swollen, the throat is really red and raw. It's kind of like a human getting strep throat. I'm sure most people have had strep throat at some time, and you're not going to feel like eating. So it's important that you're able to support the horse by giving them soft food, bran mashes, those kind of things. And the severity of the signs and the disease are going to be different in individuals. Some horses may show limited clinical signs, and it may be harder to tell that they're sick, but for the most part, the horses are going to be fairly sick. And it usually affects younger horses more than older horses. So there's a possibility that older horses have come into contact with the bacteria at some time during their life, whereas the younger horses, which we would call more naive, come into a situation, and when they're exposed to the bacteria, they're more likely to get sicker. Transmission, and I think this is where it's really important for us as an industry to address this, or at least understand it, I guess I should say. The index case or patient 0 is the first documented case with the disease. So in this current situation, we do have an index case or a patient 0. Usually these horses will have clinical signs because they're sick, and that is why you notice the snotty nose, the fever, whatever, and had your veterinarian come and examine the horse. So for the most part, we will have these clinical cases. However, sometimes, and this is where things get a little complicated, is that we'll have carrier animals as well. So with carriers, these are usually horses that were previously sick with strangles at some time during their life. And for 10% of those horses who are sick, they will have a persistent infection in their guttural pouches. And the problem is that these horses will intermittently, so every now and then, decide they're going to start shedding the bacteria. And that is how you can get strangles in your stable without realizing it. So the horse may not appear sick coming in, but because they are intermittent shedders, then they can pass the bacteria on to other horses. Strangles is spread through direct contact, so that is nose-to-nose contact. It's not like COVID, so it's not spread through the air, it's not spread through droplets. Horses literally have to either touch noses, come into contact with the discharge that is shedding that bacteria, or through transmission through fomites. So fomites would be, for instance, if I was in a barn and a horse, you know, blew its nose, snot got on my shoulder, and then I went into another barn and that other horse came into contact with the discharge that is on my shoulder. Also, it can happen through contaminated stalls. So if you have a horse that is sick and then you threw a horse into that stall for a little while after trained or whatever, transporting in trailers, sharing bridles. I mean, how many barns have jogging bridles? And that is just how easy these things can spread. So trying to keep things as dedicated as possible to individual horses, especially if they're showing any signs of illness, is really important. So timeline is important as well. At first, it may just look like a virus, and it is the time of year when our yearlings have come in and they're starting to get the virus. So they have the snotty nose, they may have a mild fever, and these things are really important to keep in mind. Typically, after a horse has been exposed to the Strangles bacteria, they will start to show clinical signs 3 to 14 days. So that 3 to 14 days is the incubation period. And that is the time when basically that bacteria is just starting to kind of percolate inside of them before they start actually telling you that they're sick. Usually they'll start with a fever, and that is why it's so important that you monitor for fevers twice a day. So take the horse's rectal temperature morning and evening. Then they'll have a nasal discharge, swollen lymph nodes, and you can feel those under the chin, under the throat, and also in the back of the throat as well. And they will start to act a little more depressed for the most part. Typically, horses will begin to shed the bacteria in their nasal discharge 2 to 3 days after the onset of fever. So that is, I think in many ways it's a gift because you can hopefully identify a sick horse before it really starts to wreak havoc in your stable, and then you're able to anytime you have a horse with a fever, it's best to try to isolate them at the end of the barn, or preferably in an isolation barn, but honestly, we don't all have that luxury. So for horses who are sick, they usually continue to shed for another 2 to 3 weeks. However, some as long as 6 weeks as well. And for some horses, they'll get an infection in their guttural pouches, and we call that an empyema. So they'll get a lot of pussy discharge in their guttural pouches. And for those horses, they can become carriers and they can continue to spread the bacteria for a very long time. After exposure, the lymph nodes usually rupture within 1 to 4 weeks. And for some horses, those lymph nodes will actually rupture into the guttural pouch, and that's how they can become persistent shedders. And I have a diagram of that in a little bit to help you kind of visualize what I'm saying. Well, here's the diagram. So if do I have a pointer by any chance? Yeah, laser pointer. So if you look in the middle of the diagram, it is the guttural pouch. And then in the bottom, great, thank you. So here we have the guttural pouch. These are the submandibular lymph nodes, and these are the retropharyngeal lymph nodes. So when this retropharyngeal lymph node gets really swollen, gets really infected, and gets really full of pus, it can often rupture right into that guttural pouch. And that's why the guttural pouch can become infected and persistently shed the bacteria in these horses. So this is a picture of the guttural pouch. I'm sure you've all seen one on the upper airway scope. This is the opening to the airway, and then these are the guttural pouch openings. Inside the guttural pouch, there's a lot of really important things. There's arteries and nerves. So sometimes when the infection gets really severe in the guttural pouch, and that can actually cause nerve damage, and then horses can become roarers. So that would be a very rare complication, but it can happen. And this is just a picture of the guttural pouch and all of the pus. And sometimes what happens when the pus gets dried out, then it becomes little kind of concrete marbles, and we call those chondroids. And for horses that are persistent shedders, then you end up having to go in and actually remove all those chondroids because they act as a source of infection. And this is pretty rare, but it certainly can happen, and it's important if you have a stable that's having a lot of these kind of recurrent outbreaks of Strangles cases, then you need to really look at the source. It's very similar to COVID. Right now, if you test positive for COVID, they're going to do all your contact tracings, and so it's really, really fairly similar. So some of the rare complications, and I don't want to scare anybody, these are not very common. I've dealt with quite a few Strangles cases, and Purpura hemorrhagica is the one that usually comes up the most in the literature when we talk about complications. These horses are very sick. It's an immune-mediated vasculitis, so the vessels become very inflamed and they start leaking fluid, and the horses are quite sick. They end up with these bruising in their gums and their legs, But it is a very rare complication. I've only seen 3 cases in 19 years, so it's not something that is, likely going to happen, but it is a possibility. Another possibility would be bastard strangles, and this is when lymph nodes, not just in the throat area or under the chin, get infected. And this can be a complication, especially when antibiotics are used inappropriately. They can also have myositis, so just really badly tie up. And if a horse, like I said earlier, if the lymph nodes swell so badly that it's literally strangling them, then they may need a tracheostomy, but I have yet to see that. The death rate is less than 1%, which still seems like a high number, but it really is not very common. So testing, I think that this is the most important part because it'll help us kind of figure out who may have a clinical illness and also who may have been exposed and who could be a carrier. So there's 3 different ways that we can test. One is a culture, and that is going to detect live bacteria in the sample. And then there's something called a qPCR, which is a polymerase chain reaction. And the thing about the PCR test, and this is what is new in the consensus statement from 2018, so this really has evolved a lot in the last 10 years. The PCR actually detects live bacteria, or the DNA, sorry, from Strep E. coli, but it can't tell whether that bacteria is alive or dead. But it does tell you that there is DNA from that bacteria. It is a lot more sensitive than cultures alone, but when you combine culture and PCR, that is when it can be it really tells you the full story. If you do one or the other, it's not kind of as meaningful as when you do both tests together. Routine blood work, like your CBC chemistry, is not going to be helpful here, other than it may tell you if the horse is really sick, then a CBC could be beneficial. We can also test for antibodies for the SEM antibody titer, but this is something that usually peaks around 5 weeks. It stays up for about 6 months, but ultimately the culture and the PCR are going to be more important. There's a lot of different ways that you can do the testing, and the sampling is going to be very important in order for you to get an accurate result on your test. We can do a lymph node aspirate or swab, a nasal swab, nasopharyngeal swab, nasopharyngeal wash, or the guttural pouch wash. The more important tests, the more successful tests at identifying the disease or the bacteria would be the nasopharyngeal wash and the guttural pouch wash. So I'm just going to very quickly go through these. The lymph node aspirate, the good news is that it's easy to perform, and if you have a good, juicy, infected lymph node, then you're usually going to get a high yield of bacteria. However, you need the enlarged lymph node in order to do that test, and it may not be able to detect the disease early on in the disease process. The nasal swab is also easy, but basically it's not going to be as accurate because you're only getting whatever discharge you are getting on that swab when you swipe it over the discharge. It's kind of like, after a good frost, you go out and you take your ice scraper and you do one swipe up the middle of your windshield. You really can't drive to town just by looking through that one little spot on your windshield. So it's better if you can do something like a nasopharyngeal wash or the guttural pouch wash. And the other problem with this test is that it can create a lot of false negatives. And a false negative is basically a horse that is truly positive, but the test is going to be negative. And the big problem with that is that it gives you a false sense of security that your horse is okay, and potentially because of that, you could infect other horses, not just in your barn, but in other barns as well. The nasopharyngeal swab is, It's essentially taking like a feather duster to the back of the throat. I don't know if anybody's had a COVID test here, but I hear it's not very pleasant. Some people say it's kind of like they're trying to take a sample of your brain because they go back so far. So that is kind of what I equate it to. It's also very similar in that you're only going to test the sample that you're getting from contact on the back of the throat from that one area. And if the horse is not shedding consistently the bacteria, then you also may get a false negative test. So the nasopharyngeal wash is one of the two preferred methods, and it's fairly easy. What you do is you use an insemination pipette for breeding mares. You put it up to the back of the horse's throat, inject saline, catch the saline, and then you submit that sample for either culture or PCR. Once again, it can be problematic as far as you may get a false negative if it is early in the disease process or if the guttural pouches are not shedding the bacteria consistently. And then there's the guttural pouch lavage, which is considered to be gold standard. It's a little more complicated to do. It's a little trickier. You need a scope, that kind of thing. Takes a little longer, but it is very effective. It may not be as effective early on in the disease process because the infection may not be established in the guttural pouch, and that's why in some situations the nasopharyngeal wash is preferred over the guttural pouch lavage. So, we have a horse that is showing clinical signs. We have diagnosed it as having strangles. Now what do we do? And apart from our biosecurity practices, which we're going to talk about in a couple of minutes, the biggest thing that most of these horses need, just like people who have the flu, is good nursing care. The abscesses, the lymph nodes in the throat area, for the most part, they need to rupture. And you can speed that up just like you would by, if you had an abscess on a horse's neck by hot packing, applying poultice. However, once that lymph node ruptures, keep in mind that that pus is going to be highly contagious because it is, for the most part, pure bacteria. Also, because the horse is going to have a fever, they're going to be in a lot of pain. Like, this is a painful disease. Then giving them some form of NSAIDs, so either bute or banamine, that will help with pain, inflammation, and fever as well. Feeding, for the most part, the horses aren't going to feel like eating. They have a fever, they have a sore throat, so if you can provide some sort of a mash, soaked hay cubes or something like that, so you can get some nutrients into them so that they can hopefully start to feel better soon. And of course, water is very important. It is cooling on the horse's throat, and it's important that horses stay hydrated throughout this, especially when they have a fever. And if you are giving any NSAIDs, that it's important that they're hydrated enough that they don't end up with having some kidney issues. So, when do we use antibiotics? Everybody, thinks antibiotics can cure everything. And the good news is that with strangles, because it is a bacterial infection, antibiotics can be helpful. However, they should only be used when appropriate. They're not going to prevent the disease from progressing, but there are some instances where if they have an infection and it's not going away, then it can be beneficial. If the lymph nodes are really swollen and it's causing respiratory problems, then it can be very beneficial. If the horse has bastard strangles and has infected lymph nodes throughout their body, it can be helpful. If they have purpura, it can be helpful along with corticosteroids. If you have a horse that does have a persistent infection in their guttural pouch and they're an asymptomatic carrier, so they carry the bacteria but they're not showing signs, then it can be helpful to not only treat them with penicillin in the muscle, but also inject basically a penicillin jello cocktail directly into their guttural pouch, and that can help with horses who are persistently infected. But as always, it's best to consult your veterinarian about these things and try to come up with some sort of a treatment plan that will help the individual horse. So there is a vaccination for strangles. I find in this part of the world not a lot of people use it unless they've actually had a problem with strangles in the past. And it is an attenuated live intranasal vaccine. So it's a little trickier because it's not a killed vaccine like most vaccines. And it has to be basically squirted up the horse's nostril, which they don't tend to enjoy. It's important, though, that it's only administered to healthy horses. And if you do have an outbreak in your stable, now is not the time to actually be vaccinating. It's better to wait. There are some possible complications with the vaccine. If a horse has had an infection of strangles in the past, they could potentially develop purpura. So it's also something that you want to consult with your veterinarian about. So, prevention, the biggest thing that we can do to prevent and control the spread of the disease is through good biosecurity practices. The biggest thing that you can do is when you have a new horse coming into your facility, they should be quarantined for 3 weeks. And it's fine for me to stand here and tell you that, but for the most part, it's not practical. You may be getting a new horse that's coming from another province for racing, for stake races, for Old Home Week, for Gold Cup. In a perfect world, these horses would be quarantined, but I realize that that is not always possible. The other thing you can do is screen new arrivals. So if you have a new horse coming to the stable, you can do your guttural pouch lavage and make sure that they're not persistent carriers. Educate your grooms, your trainers, everybody in the barn who's dealing with horses as to good horse handling practices and just trying to decrease the risk of contaminating other horses. When you do get a new horse, don't put them in the middle of the barn. Try to keep them at an end where they're kind of isolated. There's not as much traffic going by the horse as well, and there's less chance that that horse will possibly spread not just strangles. Tonight's talk is about strangles, but there's a lot of other things that we need to be concerned about, like herpes virus, influenza. So this is really just good practice for overall horse health and wellness. If you do have a horse in your barn who is sick, then it's ideal to work on the healthy horses first and then save the horse that is sick towards the end. Don't share bridles, disinfect your stalls, disinfect your trailers as well, because it can be spread through transportation. And just try to, disinfect all equipment, forks, brooms. I know it sounds like overkill, but the more steps you can take to prevent the spread of the disease, the better. Oops. As far as dealing with the bacteria itself, sunlight will kill it. When I dealt with my first case, they felt that it could live for 6 weeks in the environment, and that's because that's how long it lived in a laboratory. But in the real world, that was not the case. So sunlight will kill the bacteria. You can use different disinfectants, which are very helpful. The important part, though, is that you remove any manure, any pus, any blood, because if you have all that organic debris in the way, then the disinfectant isn't going to be able to get in and actually do its job. And also, if you have horses turned out in fields, then you probably want to, keep them off those paddocks for a week or two. Different disinfectants that you can use would be bleach. At the university, we used accelerated hydrogen peroxide. That is what our infectious disease specialists feel is best in our environment. Virkon is potassium peroxymonosulfate, and there's other quaternary ammonium compounds as well. So for the most part, most of your disinfectants will actually work against the disease. So for controlling outbreaks, I like to use a stoplight kind of model, we all know what red, yellow, and green mean. So the important things that are the first step that you need to take would be to detect any horses that could be ill, separate those horses from the general horse population within your barn, and treat them as necessary. So what you want to try to establish are 3 zones: your red, your yellow, and your green. So your red zone is horses who are infected. So preferably they're isolated in another barn. If that's not possible, then you want to kind of separate them into an area for your barn where they're not going to come in contact with other horses. The yellow zone is for exposed horses who are not clinically infected. The problem is that they could be incubating the disease or the bacteria rather, for 3 to 14 days. So even though they're yellow now, they can pretty quickly move into the red zone. So you want to keep a really close eye on those horses. And then you have the green zone, which are the not exposed horses. They're, theoretically clean, but once again, you still want to keep an eye on those temperatures twice a day. So for the protocol for the yellow and green zones would be taking rectal temperatures twice a day. If a horse has a fever above 38.4 or 101 degrees Fahrenheit, then they immediately move into the red zone. You do not want to share any equipment between zones. And ideally, you want to have dedicated people to be working with those different groups, but realistically, we don't all have 3 extra employees. So if the same person is working with all the horses, then you should move from the green to the yellow to the red zone. So the healthy horses to the horses who hopefully are healthy but have been exposed to the sick horses. You want to change your clothing, shower, use foot baths, dedicated footwear, all those types of things to try to control any possible contamination of the bacteria from the red zone down to the yellow or green. Environmental persistence, they have shown that the bacterial will live for only a day or 2 on soil and other surfaces. However, it can live for 4 to 6 weeks in water. So this is probably not a big issue at the track, especially if you're cleaning your buckets and disinfecting them every day. But if you have a group housing situation where you have horses turned out in a herd, or you have maybe 10 or 12 horses in a field, then this can very easily spread throughout your whole farm. So it is very important that those water troughs be cleaned as well. So testing for carriers, as I said earlier, 10% of horses who were sick with strangles can become persistent carriers. The testing protocol for carrier horses or suspected carrier horses, if you have a horse that had clinical signs, then you want to wait 3 weeks until they have stopped discharging from their lymph nodes, or until you have stopped treating them with antibiotics. For these carrier cases, you can do one guttural pouch lavage where you do the PCR testing and culture. And when you're looking at carriers, the guttural pouch lavage is preferred over doing the nasopharyngeal lavage because you're looking for that infected state within the guttural pouch itself. I like this chart because it kind of gives you an idea of what would make a low risk, a medium risk, and a high risk stable, basically. Someone in Europe made this because they talk about yards, livery yards versus stables, but basically I would consider the racetrack to be a high risk, simply because of the number of horses that are stabled here. There's also frequently new horses coming and going. We have horses from all over the Maritimes racing here, and from all over North America, really, certain times of the year. So, we've talked about the risk from horse to horse, but there is a very small risk to humans as well. It is a zoonotic disease, so it is possible that you can contract the strep equi bacteria. It is very unlikely for someone who is healthy, but if you have someone who is working with horses and they're immunocompromised, whether from some sort of an immune-compromised disease, if you have someone who's a cancer patient and is undergoing chemotherapy, then they probably want to take more precautions and just be a little more cautious with the bacteria. So these are some of the resources that I used. I do encourage you to look up information. Just keep in mind that the site that you're getting it from, go to reliable sites such as the American Association of Equine Practitioners. Dr. Scott Weiss from Guelph has some really good information, as well as the Ontario Ministry of Agriculture as well. And I do apologize, I did have good intentions of making a fact sheet for owners, which could be next week's project, but this week it just kind of got away from me. So that is it. I hope that I answered some of your questions. Hopefully it alleviated some of your fears. I think the biggest thing to keep in mind is that that there has to be direct contact between horses or through contact with fomites, with nasal discharge in order for the disease to spread. You can control it as best as possible by having good biosecurity, trying to minimize the movement of horses. And if you do have any questions, I'm happy to answer them. You can email me at kmacmillan@upi.ca. Most of you have my cell phone number anyway. And talk to your veterinarian. You know, we're here to help. We don't want this to go any farther than it has. And hopefully everything will resolve soon and we can get back to normal activities as much as COVID will let us. So, thank you.
Well, thank you very much, Dr. Kathleen MacMillan, here tonight with a presentation and on the Strangles 101. And we want to take the opportunity to thank you for those of you who are not in attendance here tonight but are joining us on our broadcast through Redshores.ca. We certainly do appreciate you taking the time to tune in. And as Dr. MacMillan said, it's about information and having the right information and staying in contact with your veterinarian. So I also want to remind you that we will be taking this presentation and we'll have a copy of it and we'll be making ways to get that loaded, preloaded for folks who would like to see it again. So thanks for joining us tonight and thanks for tuning in, and we'll talk to you again soon.